Good afternoon, everyone. On behalf of the Retirement Center and Director Carrie Sweeney, I am pleased to welcome you to the annual Carol D'Onofrio Lecture in Public Health. This series honors a generous request of the late Carol D'Onofrio. Excuse me. Professor Emerita of Public Health, Carol D'Onofrio died in April 2020 after a distinguished career in the School of Public Health, the school from which she received her master's degree in 1960 and a doctorate in 1973. She served on the Berkeley faculty for more than 40 years. She was honored as the school's Alumna of the Year in 2009, and she was named as one of its 75 most influential alumni in 2018. I myself came to know Carol when, after I retired, I agreed to serve on two committees, one being the Executive Council of the Berkeley chapter of Phi Beta Kappa, of which she was a longtime member and held various offices, and the other being the Learning and Retirement Committee itself, which she chaired before me. She was devoted to both of these projects and the purposes of these committees, and even in her final year when she was hampered by illness, she tried valiantly to participate in them. In these contexts, her dedication to helping others and upholding the highest standards of engagement in research, teaching, and public service of the university were always clear to see. In her research, Carol was strongly committed to the concept of equal access to health care and to improving the health of populations generally neglected by our heavily for-profit American healthcare system. And many of the talks that we have arranged in her honor in this series have touched on things related to that theme, but not all of them. On behalf of Director Sweeney, the LIR committee, and all of us, I want to express our gratitude for Carol's contribution of time and effort during her life, and for her generosity in endowing retirement center programs such as this one. And now I'll turn it over to John to introduce today's distinguished speaker.
Good afternoon. It is really a tremendous pleasure for me to introduce Elena Conis to you. A little background first. There have been over 900 reported cases of measles in the United States so far this year. Last week's poll by the Kaiser Family Foundation showed that about a quarter of adults incorrectly believe that the measles, mumps, and rubella vaccine is definitely or probably linked to autism. And about a quarter believe that vitamin A can prevent measles infections. About a fifth believe that getting the measles vaccine is more dangerous than becoming infected. These misconceptions in that poll were especially prevalent among Republicans and Hispanic adults. At the same time, whooping cough has been rapidly increasing in the 2000s, with about 10,000 reported cases each year. This year, in the first 3.5 months, there have been over 8,000 reported cases of whooping cough. So this is compared to less than 4,000 for the same time in 2024. And there are more than 4 times as many whooping cough cases in 2024 as compared to 2023. And then ongoing cuts in the federal health funding and personnel could jeopardize the effectiveness of the CDC's funded Vaccines for Children program. This federal program has an annual budget of roughly $5 billion and dispenses about half of the vaccines administered to U.S. children every year. Well, that's a pretty dismal picture, but we're fortunate to have Professor Conis here today to give us some insight. Professor Elena Conis is a writer and historian of medicine, public health, and the environment. Her research focuses on scientific controversies, science denial, and the public understanding of science. She's the author of several highly acclaimed books. Prior to coming to Berkeley, Conis was a professor of history and the Mellon Fellow in Health and Humanities at Emory University, and an award-winning health columnist and reporter for the Los Angeles Times. Currently, she is serving as acting dean of the UC Berkeley School of Journalism. She is also an affiliate of Berkeley's History Department and Center for Science, Technology, Medicine, and Society. And she's an affiliate of the Department of Anthropology, History, and Social Science Medicine at UCSF. Hesitancy and resistance to vaccination is more common than not in the United States. Her talk will explain how and why public attitudes towards vaccination have changed over time, with an emphasis on the 20th and 21st century trends reflected in today's vaccination debates and controversy. Dr. Conis.
Thank you so much, John, and thank you, Donald and Camille, for inviting me to speak to you all today. It's an honor and a pleasure, and I'm so delighted to be able to share a little bit of my perspective on today's extraordinarily important and hot button issue of vaccination and vaccination resistance. I am first and foremost a historian of science with a focus on the history of medicine and public health in the US, and much of my research has focused on the history of vaccination. And so this particular area of research has become more relevant than I ever could have imagined when I first embarked on it almost 2 decades ago. What I want to do today is kind of start with some just kind of basic understandings and assumptions about the present moment, ask the question how we got here, and then rewind the clock all the way back to the very beginning of vaccination to begin to answer it. I'm not going to cover 200 years plus worth of vaccination history, but I'll start at the beginning to introduce some key ideas and then pick up the story at the turn of the 20th century, where we really in the US got on the trajectory that helps us understand how we got to where we are today. So Dr. Schwarzberg really helpfully outlined a few key characteristics of the current moment. We have an extraordinary measles outbreak across multiple states in the country right now, especially Texas, Oklahoma, New Mexico, and I believe Kansas. Causing a number of measles cases that is fairly unprecedented in recent years, although since the 2010s, we've been seeing um, an increasing number of measles outbreaks of increasing size. Dr. Schwarzberg also referenced the fact that in a recent poll, about 20% of American adults said that they feared the measles vaccine more than the disease itself. And I highlight these two facts because the current measles situation is in part why we are talking so much about vaccination and vaccination resistance. But there's something much more broader behind these facts, which is an extraordinarily high level of distrust in vaccines and extraordinarily high level support for these mistrusting views of vaccines and vaccination. So to begin to tell the story of how we got here, I often like to let people know from the outset that the story of the history of vaccination cannot be disentangled from the story of the history of anti-vaccination. Put much more simply, as long as we have had vaccines, we have had resistance to vaccines and fear of vaccines. And as long as we have had forced, enforced, or compulsory, also known as mandatory vaccination, and by we, I'm saying here in the US, we have had opposition to enforced or compulsory vaccination. The first vaccine, as some of you may well know, since this is a public health sponsored lecture in part, was the vaccine against smallpox, created successfully for the first time in the late 1790s in Europe and rolled out across Western, Eastern Europe and parts of Asia in the very tail end of the 1700s and the early 1800s. It was received in an extraordinarily positive way by state governments and by the medical profession. And it was received in a very different way by the working class and the poor. And I am speaking in really broad, generalized terms, but what's important to know about the early decades of vaccination is that it was seen as a tool that gave states for the first time unprecedented power to prevent infectious disease epidemics, namely epidemics of smallpox, which had been so hobbling to states and state economies for centuries in Europe. And the fact that there was this public health tool that had this capacity inspired states to take new steps to use it in different ways, namely by making vaccination required either of entire populations or certain subsets of the populations. In France, in the early 19th century, there were laws that required it of those seeking welfare from the state. In England, there were similar laws. There were also practices that were not encoded into law, but that led vaccination to be enforced among the working class and less enforced among the privileged. What this meant was that from the outset, there were a few key types of resistance to vaccination. There was resistance to those who did not trust the institutions of power that were advocating for the smallpox vaccine and its use. There were also at the same time other sources of resistance, namely folks who were worried about the safety of the smallpox vaccine, and I'll say more about that in a moment, and folks who thought that the smallpox vaccine's medical powers were a direct affront to God's powers and therefore did not comply with their religious beliefs. The very first smallpox vaccine was based on material taken from the pox of cows infected with cowpox. And this is what led to initial safety concerns about the smallpox vaccine and fears of that vaccine. Folks with already extant reasons for mistrusting either the medical profession or the state were even more likely to resist smallpox vaccination because it was sourced from cattle and from diseased cattle at that. Religious objections that also cropped up in the early 19th century maintained that to administer an animal matter to humans with the express intent of in effect, stopping God's will from taking place, if it was God who decided who got sick and who did not, was incompatible with their religious views. So we get a few decades into the 19th century, the early decades of vaccination, with these fears based on the risk of taking animal matter into one's body, the fears based on religious beliefs, and then increasingly added to those were fears based about or rejection or opposition to vaccination based on ideas about rights. To explain that, let me point out that because there were so many people who had either religious or risk-based objections to vaccines, governments, in particular in Western and Central Europe, began experimenting with different types of vaccine mandates, laws and regulations that said who had to be vaccinated, under what conditions, and when. And these mandates eventually led to organized resistance to vaccination based on an argument of rights. And this was an Enlightenment-informed argument that said that man, and the language that they used at the time was man, in his natural state, should have bodily autonomy and should, in enlightened democracies, retain the right to determine his own medical care and his own medical needs. The folks who advanced these arguments tended to be intellectuals in England and France, and they proudly called themselves anti-vaccinationists. They were less concerned with the risk and religious-based opposition to vaccination, and they put these rights-based arguments front and center. And in the 1850s and 60s, they circulated these ideas throughout Western Europe and began to gather the attention or attract the attention of a handful of public intellectuals, writers, and in some cases, medical practitioners on the other side of the Atlantic in the United States. And this didn't happen until about the 1850s or 1860s because there was very little compulsory vaccination in the US until that time. In short, we made it a full half century into the history of vaccination in the US, relying almost not at all on compulsion or mandates or law. Vaccination was practiced in a very reactionary way and in a very individualized way. Folks got the smallpox vaccine when they decided to, or when they decided to get it for their families. And in rare occasions, there were local laws that required it, for instance, for school children, or in the event of what seemed like an imminent surefire epidemic because of one in neighboring areas. But around the 1850s and going into the early 1860s in the US, what we began to see was that in an increasingly industrialized nation and an increasingly interconnected nation, there was more and more attention at the local level, really across the board, to creating more governance focused on public health. Some of this had to do with outbreaks of other diseases, for instance, cholera, for which there were several large outbreaks in the 1830s, late 1840s, going into 1850, and then again in the 1860s. Other diseases, tuberculosis, and also smallpox. As these cities began to create their boards of health, they endowed these boards with several powers. And among these powers, in several cases across the states, was the power to enforce smallpox vaccination when necessary. Very few in the 1850s and 60s, very few, if at all, of these boards of health actually used that power, but there was more and more talk of it and more passage or creation rather of these boards of health with this power in the years leading up to the Civil War. What the Civil War did in this story, and I'm going to mention it only briefly, was bring attention to how quickly really horrific outbreaks of infectious diseases could occur and how devastating they could be in populations once they are moved en masse and result in the transfer of populations with very little disease exposure to areas where they suddenly have a lot of disease exposure. There were massive outbreaks of smallpox, of measles, of mumps, of tuberculosis, of other diseases during the Civil War. And these infectious disease outbreaks were so great that in many cases, they exceeded the toll that was taken by battle wounds and were at that point recognized as of extreme public health importance once we got out of the war. Well, we emerged from the Civil War with a whole bunch of things on our mind as a nation, but we emerged with those boards of health still intact. Those boards of health sort of newly empowered to use some of the authority they had, and continued increase in industrialization and in transportation. And we make our way toward the end of the 19th century with a number of not just localities like cities and counties creating boards of health and thinking about boards of health, but states creating state health departments that look to some of these local models and use them as a kind of set of guidelines for what states should put in place to protect the public's health. By the time we get to the 1890s, a handful of the first few states decide to add mandatory vaccination to their public health powers. California is one, Maine is another. But by the time these states take this move, we have a full-fledged anti-vaccination movement in the US, informed by and inspired by their European predecessors, who in some cases have actually come here, given tours, spread their words, and then created local societies of anti-vaccinationists who then wrote their own pamphlets, booklets, and took out their own ads in local newspapers and began to express here why it was so important to oppose mandatory vaccination, again, from a rights-based perspective. So we get to the turn of the 20th century, and here's where I'm going to say a lot that's important begins to change, because throughout the 19th century, throughout the first 100+ years of vaccination, it was largely either an individual or local affair. Though compulsion existed, there was far less use of it than we're used to today. And what this meant, of course, in light of the changes to our nation at that time, was that if we were going to be making any changes, namely to state boards of health, then this was going to essentially kind of rattle the foundation on which vaccination had rested. If it had largely been local, if it had largely been individual, to invest states with this power and then have them utilize that power, exercise that power, was going to come as a bit of a shock to the system. And as we get to the late 1890s, early 20th century, that's exactly what happens. So I'm going to pause here to tell the story of the first Supreme Court decision that upholds mandatory vaccination. And this is a story that grows out of an attempt to enforce compulsory vaccination in the city of Cambridge in the state of Massachusetts. Cambridge had a compulsory vaccination law, and the state of Massachusetts did not yet, although it was moving toward one. But in the city of Cambridge, city vaccinators would go door to door during epidemics or before an anticipated epidemic, and they would ask people to get vaccinated. And if those folks didn't want to get vaccinated, they could face a fine. And if they refused to pay the fine, they could face jail time. These measures might sound excessively harsh to our ears today, but in fact, this is what a lot of the compulsory measures of the late 19th and early 20th century looked like. Jail time and steep fines for the time were not uncommon. When they got to the door of one particular Cambridge resident who happened to be a pastor, a Lutheran pastor who had immigrated from Sweden, this pastor said, "This seems incompatible with all of the reasons that drew me to immigrate from my country in Europe here to the US. I came here for freedom. I came here for liberty. I came here primarily for religious liberty, but I expected to find, bodily liberty as well." Jacobson was his name, and he refused to pay the fine. He refused to get vaccinated. He found a lawyer to represent him, and a long story made short, his case found it all the way to the Supreme Court. And in the case of Jacobson versus Massachusetts, the Supreme Court ultimately ruled 7-2 that states, not just cities, but states, had the authority to require vaccination of their citizens when there was a significant threat to public health and when the threat of the vaccine was not significant enough to harm the individual. In other words, there was a provision in the decision in Jacobson versus Massachusetts that acknowledged that some people might not be able to be safely vaccinated, and therefore compulsion should not apply to them. What's interesting about this moment is it really, in a few key ways, sets the tone for the next 100+ years. It says that states have authority. It says that there are limits to that authority. And what happens in response is that anti-vaccination groups absolutely rejoice. They see this as the highest level of victory that they ever could have imagined. And the public health profession responds by, over the next several decades, backtracking away from compulsion and mandates and leaning more toward persuasion and encouragement when it comes to vaccination, among other public health interventions. But this emboldened anti-vaccine movement ends up growing and growing. So even though the Supreme Court affirms compulsory vaccination, I'm sorry, I said that anti-vaccination saw this as a victory. They saw this as a defeat, but it emboldened them, forgive me, it emboldened them to seek a similar victory as as a similarly high level. So anti-vaccinationists, emboldened by this Supreme Court decision, ended up deciding to take their cause back to the local level. Some of them took it back to their cities and counties, some of them took it to their states. And what they did was they went back in some cases to those original 19th century laws, giving boards the power to enforce vaccination, and started to include exemptions or started to have them repealed entirely. Western states were most effective in passing bans on mandatory vaccination. And some of the eastern states, and I'll use Massachusetts as an example, Massachusetts in the wake of Jacobson actually had a state vaccine mandate, but it included exemption clauses that were so broad that almost anybody could be exempt from its state vaccine requirement. At this point, I want to kind of take us into what happens in California just to show us how long the anti-vaccine groups kind of stuck it out. In California itself, there were anti-vaccine societies that started to take shape in the 1890s. In the 1890s, there wasn't much for them to object against, but there were some localities and there were some institutions, such as UC Berkeley, where we are now, that passed mandates that did stir up opposition. In the early 1900s, around the time of the Jacobson ruling, in fact, there were groups of students who walked out of classes and disenrolled from UC Berkeley because they did not want to get the mandatory smallpox vaccine. And the local anti-vaccine societies, and there was a sizable one in Oakland, cheered them on. And you can read about this in local papers from the time. At this point, though, of course, there were things happening at the federal level in the Supreme Court, and what happened in California started to become part of a bigger national movement of anti-vaccine societies, kind of taking efforts and action locally to push back against Jacobson versus Massachusetts. And in California, eventually, they garnered the support of a number of lawmakers in Sacramento who began introducing bills that would make mandatory vaccination unlawful in the state of California. And they kept at it until the 1920s, when the state legislature finally passed that and voted in favor of making compulsory vaccination unlawful here. Why I wanted to kind of talk through that timeline for a moment was to kind of show that this was unfolding over nearly 30 years. There were 30 years of anti-vaccinationists kind of coalescing, coming together, pushing back, organizing, facing major defeat, regrouping, working again at the local level, and then trying to get the kind of greatest victory they could at the state level. From the 1920s through the 30s and through the 40s, across the US, the public health profession is busy with a number of other things, which I'm going to leave out of this narrative. But in the realm of vaccination, they pull way back on mandates and compulsion. There are a handful of mandates passed here and there, mostly focused on daycares or elementary schools. Very few of them actively enforced, and it is not a significant area of legislation or public health enforcement at all. This, however, starts to change with increases in polio, especially in the 1930s and 40s. There's really no talk or hope of a polio vaccine in the 30s, but in the 40s, there's growing investment in polio research. supported by the National Foundation for Infantile Paralysis, which later became known as the March of Dimes. And the March of Dimes ends up putting an enormous investment into publicizing the cause of polio and funding polio research. Two things in the 1940s coalesce to ultimately create a new vaccine against polio in the 1950s. And the first of these is a massive investment in basic scientific research during the First World War, in which there was loads of investment in the prevention of the same infectious diseases that had been hobbling troops since the Civil War. The other thing that was happening was the National Foundation for Infantile Paralysis simultaneously funding the most promising polio researchers and polio labs with the express intent of hopefully finding a successful polio vaccine. The NFIP/March of Dimes at the same time was publicizing the threat posed by polio. Polio was impossible to ignore in the 40s and 50s. The NFIP had it on every airwave, on every radio, on every television, and every local newspaper. They had chapters in every town. These chapters were focused on bringing attention to the cause and raising funds for the cause. In short, by the time there was a polio vaccine in 1954, it's safe to say the entire country was aware of the grave risk posed by polio infection and was mobilized to keep that infection at bay by getting the new polio vaccine. The first polio vaccine was debuted or approved for use in 1955 after a nationwide trial in 1954. And following the policy precedent of the previous decades, the response and the plans for using this polio vaccine were to simply put it on the market and let people get it if they wanted it. But the American public was outraged by this process and wrote to Washington, wrote to lawmakers, wrote to President Eisenhower himself and said, please do more to ensure that every child, and at the time it was effectively framed as a childhood disease, he said, please do more to ensure that every child can have access to this vaccine. The upshot of this was federal involvement in vaccination in a way that really hadn't happened yet in the US. Eisenhower rather reluctantly said, we will give funds to states, but we're going to let states decide how to use that money. The objective of this funding will be to ensure that every child who wants to be vaccinated can be vaccinated, but we will not force them to be vaccinated. And in Congress, there were heated debates about whether this or anything beyond this would constitute socialized medicine. You still, that is, got the sense 50 years later that there was reluctance to go toward compulsion. Polio changed that, however. After several years of polio vaccination, and after several years of seeing polio rates decline, what public health officials and, importantly, scientists at CDC and state health departments began to show was that polio outbreaks were still happening. And they were happening in particular in urban areas, and they were happening in particular in low-income communities and communities of color, which are, of course, not how they described them at the time, but that's how we would understand them today. And what they ultimately concluded was that without mandates, without laws that made polio vaccination a requirement, the polio outbreaks were absolutely never going to stop. There was a push at this point then to bring back mandatory vaccination. And it was framed in a way, by this time we're in the early 1960s to mid 1960s, it was framed in a way that sounded very different from how it was framed in the past. It was framed as a step toward a great society. And ultimately, President Lyndon Johnson would include public health and vaccination in this vision for a great society. We could only be a great society by this vision if everybody could benefit from healthcare and from the best that American medicine had to offer. But that sometimes meant that we had to ensure that every last citizen was availing themselves of what American medicine had to offer. In the late 1960s, the policy discussion was thereby effectively reframed. As I mentioned, a bunch of states actually had the power to enforce compulsory vaccination on their books, but hadn't repealed it yet. Some had repealed it, some simply hadn't been enforcing it. But a new era of enforcement begins to take shape in the 1960s, and it is sped along by key policies of the Kennedy administration, the Johnson administration, and later the Carter administration, all of which have the effect by the end of the 1970s of creating a whole new vaccination landscape in this nation. And I'll kind of highlight three aspects of this new landscape. One is that it was characterized by a return to compulsory vaccination. But that compulsory vaccination at this point in our history focused on children, requiring children to get vaccinated and linking that requirement to school enrollment. Another key feature of this landscape was that children were required to get vaccinated not just against smallpox and polio, which were considered among the gravest public health threats by the public, but they were also required to get vaccinated against what were in the 50s and 60s called the milder diseases, which would include things like measles, mumps, and rubella. And the third feature of this landscape was an involvement of the federal government in vaccination policy settings and recommendations in a way that had actually never happened before in this country. The federal government had stepped in back at the turn of the 20th century. This is a story for a different day, to ensure that vaccines were safe and that they were effective. But in terms of saying who should be vaccinated against what and when, the federal government had stayed out of the conversation. But at this point, a key body is formed, the Advisory Committee on Immunization Practices, which ends up residing at the CDC and setting policy recommendations for all states to follow. And what happens in turn that flows out of that are funding mechanisms that make states eligible for federal funding when they follow the guidelines coming out of the ACIP. So we get to the end of the 20th century with some of the highest levels of childhood vaccination ever recorded in this country. We also get to this point with the longest list of vaccines administered to children in the greatest number of doses ever administered to children against the kind of broadest array of vaccine preventable diseases. And that's essentially where we are when we enter the 21st century, our current century. And I'll say a few things to kind of set up the sort of final piece of this story that takes us to this present moment. Because at the tail end of the 20th century, we have not just these great vaccination successes, we also have, if anybody remembers the 60s and 70s, a whole bunch of social movements and countercultural movements, the civil rights movement, the women's movement, the related women's health movement, the environmental movement, the patients' rights movement, the disability rights movement, the gay rights movement. I could keep naming movements, but this is a lively time for social movements, in particular those that are critical of authority and that push against the prevailing culture and politics of the day. These movements end up reviving age-old anti-vaccinationism and giving it a kind of new flavor at the end of the 20th century. A new set of groups coalesce in the 1980s. They come together calling themselves vaccine safety groups. Some of them are drawn based on these age-old ideas that individual liberty is first and foremost and trumps or should trump any law requiring vaccination, be it, at the city level or the state level. Others are drawn to these groups because of the idea or the fear that there are components of vaccines that are dangerous or harmful, and they begin investigating the chemical components vaccines and raising concerns. And again, this is the 1980s, raising concerns about the relationship between these chemical components and the growing number of learning differences in children at the time. And autism is an early concern of theirs. And still others are drawn to this cause, saying that they feel that it should be an individual decision based on informed consent. This is, of course, related to the rights argument, but interestingly, at this time, grows out of the women's rights movement. Women, in other words, were saying that they had struggled to take back their healthcare autonomy from a largely paternalistic and male-dominated health profession. And now that they were in the position of making health decisions, many of them for their children, they wanted to ask the same questions. Do their children need this intervention? Why do they need this intervention? And what information has been concealed to them? And at this point, in the 1980s, they had plenty of historical examples of information being concealed. All of this is to say, we get to our current century with, once again, this renewed, emboldened, and very broad-based vaccine critical movement. And lo and behold, one of the early and influential figures in this movement turned out to be Robert F. Kennedy Jr., who wrote a piece that ended up being published in the Rolling Stone magazine in 2005 that detailed, in his view, all of the evidence linking mercury exposures to adverse health outcomes and arguing that mercury never should have been in children's vaccines and that the mercury-based preservative that was included in children's vaccines had caused irreparable damage. I'm going to say just a couple more things about RFK and then turn to the questions in the chat because I see so many of them and because it's rapidly approaching the end of our time here. But what's important to note is that what we see is RFK Jr. writing this article in 2005, kind of stepping into a movement that had already been in existence for decades, giving this movement ideas and language and evidence that it was in search of, and then in turn, seeing that movement kind of coalesce with other social movements. I mentioned earlier that when we looked at that turn of the 20th century, we saw that for decades there were anti-vaccine groups kind of taking shape, but their fights were relatively confined. But they grew more urgent, especially after the decision in Jacobson versus Massachusetts. And then those groups pushed for decades more until they succeeded in securing bans on mandatory vaccination at the state level. We're seeing history unfold on a somewhat sort of similar or at a similar pace these days as well. There are things that have been happening for decades that have been snowballing for decades, and we are now witnessing the kind of success and achievement of vaccine critical groups who felt that their values and their concerns were not being heard or acknowledged by the administration in power. COVID, of course, had so much to do with changing the narrative, and in fact accelerating the cause of anti-vaccinationism, in large part because it's exposed so many of the rifts in our society as epidemic diseases do, but also because we sold a vaccine to the public that expected it to do one thing, saw it do something slightly different, and then felt once again that their worries about the long-term safety of vaccines were not being acknowledged. Where that leaves us with respect to the present moment is someplace that is unlike any place we've been in the past, but that has so many echoes of it. And I'll highlight just a handful of those. The first of these echoes is that anti-vaccinationism has always been with us, and as long as there is vaccination, we should have every reason to believe that there will be anti-vaccination. What it also echoes from the past is this long push that these groups will sustain in order to see the kind of policy achievements that they wish to see. What we also see is that the libertarian or rights-based argument against mandatory vaccination in particular is extraordinarily powerful in the United States. It has been with us since the early days of compulsion, and it will be with us as long as there is compulsion, and even in times when there isn't. I do want to kind of return to where Dr. Schwartzberg set us off at the beginning of the hour with a reminder of what this means. And what it does mean is that we will see increasing cases of measles if things continue on their current trajectory. We already had been seeing increasing cases of measles in recent decades. We had already been seeing increasing cases of pertussis. And something similar happened in the history of smallpox as well. There were times in the first half of the 20th century where smallpox would flare up again. And then, sadly, due to a combination of vaccination plus herd immunity that was achieved in the course of these outbreaks, then we'd see a lull again. So we're entering into what is going to be an extraordinarily unique time, because historically we had less federal involvement in vaccination than we did by the end of the 20th and beginning of the 21st century. Now, I mean, I don't mean to be glib, we also have unprecedented federal involvement in, please don't quote me on this publicly, anti-vaccination. And we will see the consequences of this in terms of disease. Whether we wait this out or we innovate our way out of it remains to be seen. But the one thing that is for sure is that when we come out on the other side, we will never shake fully free of anti-vaccination. It will, if history is any guide, always be with us.